Welcome back to GTU. Colorectal cancer is the leading cause of cancer death in men under 50 and the second leading cause of cancer death in women under 50.
Joining us now in this sponsored interview is Surgeon Matthew Bobel to talk more about what we can do, when we should start the screenings, and these statistics.
Yeah, so young onset colon cancer, which is defined as when you're diagnosed under the age of 50, has been increasing a lot recently. In the last 20 years, we've seen a 50% increase in people under the age of 50 getting diagnosed. And this has resulted in the U.S. Preventative Task Force of decreasing the screening age from what used to be at 50 down to 45. But even with that reduction, we're still seeing 80% of people ages 45 to 49 not getting screened.
And why do you think that is, especially when it is so important and increasing in awareness?
Yeah, I think some of it is people just don't know. These are newer guidelines in the last couple of years, and so as public gets more aware and physicians get more aware, screening will increase. But also people don't like doing colonoscopies. I'm sure you've had friends or family members who talk about the prep ahead of time, but luckily there are some other screening methods too.
Let's talk about that. I have parents who just recently went through it, but I hear more positive stories than not. They say it's just a little nap and you don't even know and you are completely fine and you got to have a little rest.
Exactly. Yeah, as we keep developing better preps, people can tolerate that better at home. They don't have the symptoms of nausea and all the discomfort associated with it. And then the day of, I say that you've already done the hardest part and now you get to go to sleep for a little bit while we check things out.
It definitely gives you the peace of mind knowing where you're at and being proactive about that. You know, it's really interesting. I'm in my 20s and there are friends of mine who are facing these challenges and have colon cancer. What can we watch for even when we're under that age of 45 to be proactive?
Some of the common symptoms are unfortunately pretty vague. So there are things like abdominal pain, rectal bleeding, iron deficiency, anemia, or change in your bowel habits can all be signs that there could be something in the colon.
And so important just to be proactive if anything seems off or unusual for you. Just peace of mind, go and check it out.
Exactly.
What else does a screening look like? It's not always a colonoscopy, but there's other things we can do.
Correct. So there are some at-home stool tests that have been developed. These tests are primarily for people who don't have a family history of colon cancer or don't have a family history of colon polyps. But these tests can be done at home, and then you can send the samples into the lab, and then they can tell you whether you need to have a colonoscopy if they find anything concerning.
So you're making that available, and it's not invasive, and so people are more inclined. What would you tell that 80% of people who are apprehensive about going and getting screened?
I would say really it's for your own health. The number of people, like you mentioned, that we're seeing younger and younger getting colon cancer is just devastating. Having to have those conversations about family planning and having young kids and what happens treatment-wise if they are diagnosed, it's much harder if we catch it later versus if we're preventative and find things early before they develop into cancer.
So say that you are feeling okay, but maybe you have some family history. Do we want to go in a little bit sooner than 45? When should we start that?
Yeah, so if you have a family history of colorectal cancer or colon polyps, we recommend starting your screening 10 years before the person was diagnosed or at age 40, whichever one was earlier.
Those are some important things to note. All right, when it comes to Granger Medical, what are you doing to help support patients through this process?
Yeah, so we, all of our primary care providers are staying on top of making sure everyone's getting screened and sending referrals to myself and my partners, as well as our GI doctors that we have at Granger Medical. Additionally, we're celebrating kind of cancer this year as part of our foundation fundraiser, and we'll be doing a race later this year called Colors for Cancer, and one of the colors obviously will be for colorectal cancer.
Yeah, you know, you can tell that you care, and you can feel the warmth from you and from Granger Medical whenever you stop by. So no reason not to go and be proactive and get checked out. Come and meet the team. Hey, thank you so much. Such great information.
Yeah, thank you so much for having me.
And thank you again to Granger Medical Clinic for this sponsored interview.